Hello folks, we're here with Dr. Bill Hrushesky. He is a scientist, inventor, and cancer doctor. He is the creator of Cancer Medicine, which uses time to prevent, diagnose, and control cancer and its symptoms more effectively. Dr. Hrushesky, would you please tell us a little bit about your paper entitled Temporal Tuning of Daily Rhythms Helps Advanced Cancer Patients and Cancer Survivors Feel Better, Live Better, and Live Longer?
Well, Ron, thank you very much. I'd be very happy to do so. I think this starts with a little lesson in physics. The biological time comes from the dynamic daily and seasonal relationships of Earth and Sun, which have been incorporated into the genomes of every Earth-born life form during the last 4.5 billion years. I think it's really important to consider that artificial light has only been around for about 100 years, and that certain diseases can also affect biological timekeeping, but light at the wrong time of day can have a huge effect, disrupting biological clocks and their essential internal timekeeping. So every cell in our body knows what time it is. Good quality sleep, properly timed within each day, and of adequate quality and duration is absolutely essential to both optimal health, or any kind of health, and is actually essential to human life and to the life of every organism who sleeps, which is basically every living organism. Cancer is a very important and nasty problem, and good sleep is disrupted by cancer. It's one of the very first things that happens. And cancer disrupts the internal time structure, the internal clock structure within us, and in many ways, and most prominently by disturbing good quality sleep and diminishing nightly sleep. Protracted and worsening fatigue results when we don't sleep or we don't sleep well, which is universal in most cancer patients and many cancer survivors. This is what causes fatigue, and fatigue diminishes enjoyment and engagement with life, and it also diminishes appetite. Appetite is essential to maintain nutrition, and diminished appetite results in poor nutrition, decreased strength, and decreased general resilience. It's what we see in people with cancer, and people with AIDS before it was treatable, and in other situations, people wasting away and not being in any mood to eat. The diminished robustness associated with this directly causes anxiety and depression. We've studied this a lot with regard to people's timekeeping capacity, and we find people whose timekeeping capacity has been disturbed by cancer are more anxious and more depressed. And if we can improve their sleep and improve their circadian or daily organization, their anxiety goes away and their depression diminishes. These are important goals. Finally, unopposed daily temporal disruption accelerates cancer progression and hastens death. So not only do cancer patients have messed up biological rhythms, that disorder of biological rhythms has a very negative effect on the host-cancer balance, causing the cancer to grow faster, the host to be sicker, and to die sooner. So what we have done in this paper is demonstrate that there are ways, simple behavioral, non-toxic ways, to be able to interrupt this vicious cycle. And with some simple behavioral modifications that we learn of from studying each individual's minute-to-minute or activity levels, and minute-to-minute light exposures, and minute-to-minute sleep quality and quantity, we can then look at those results with algorithms, as we do when we create apps, and we can then re-enter the system and give that person individualized, personalized advice about meal timing, exercise timing, light exposure timing, light avoidance timing, nutritional hints, all about time, timing of their various medications that would diminish the side effects of the medications and enhance the positive effects of the medications. The timing of pain medications does tremendous damage in cancer patients if the long-acting pain medicines are taken at the wrong time of day. These are simple, logical things that can be done to make people feel better, live better, and live longer. And that's what this paper is about, and we hope that people read it and take our advice, because we've studied this extensively for more than 3 decades, and we know that these simple behavioral modifications help. Thank you very much.